Thank you very much. Chair now recognizes Ms. Bush from Missouri for 5 minutes.
Thank you, Mr. Chairman. St. Louis and I are here today specifically in support of Medicare for all and health care as a human right, leaving life or death medical decisions in the hands of drug manufacturers and multi-billion-dollar PBMs instead of patients and their healthcare providers is literally killing people. Let's put this conversation into context. In the wake of a deadly pandemic that has left millions traumatized, disabled, and suffering long-term health challenges, Republicans are using the debt limit to needlessly restrict access to Medicare and Medicaid. This will leave millions more uninsured or underinsured and have to rely on predatory corporations like PBMs to receive medical care. As we've heard today, pharmacy benefit managers are intermediaries that negotiate with drug manufacturers, health insurers, and pharmacies to determine the cost and the coverage of medicine. As a nurse, I've seen America's broken healthcare system force patients to make the impossible choice between paying for life-saving medication or buying groceries. I've seen them cry because their medications were changed and the doctor ordered one thing and they were not able to get that particular medication because of this broken healthcare system. When congressional Democrats and the Biden administration worked to pass the Inflation Reduction Act, we capped the price of insulin for Medicare beneficiaries and empowered Medicare to directly negotiate lower prices for drugs. But St. Louis and I know that we still have such a long way to go. That's why Senator Bernie Sanders and I recently introduced the Insulin for All Act, historic legislation to rein in Big Pharma and cap the price of insulin at $20 per vial for every person who depends on insulin to live. The privatization of our healthcare system itself is at stake, which is why I stand with my colleagues and I demand Medicare for all be enacted now. Dr. Dwayne, according to a 2019 study by the American Medical Association, 1 in 8 pharmacies closed between 2009 and 2015, and these closures disproportionately affected independent pharmacies in low-income neighborhoods. In St. Louis, 15% of residents live more than a mile away from a pharmacy, and the lack of trust in culturally insensitive medical providers, which I've seen firsthand, can pose just as great a barrier to accessing care as a lack of transportation. What can be done, Dr. Dwayne, to level the playing field so independent pharmacies like Greater Health in my district can keep serving our communities and those hard-to-reach populations?
Yes, ma'am. Thank you for the question. I think that the biggest thing that we could do is to make sure that providers are being not asked to subsidize any system that is in place. And I think that, my pharmacy is in a predominantly low-income area as well. And sometimes we have to make heavy decisions about whether we participate in certain Medicare plans or whether we participate in certain Medicaid plans because we know that it won't be sustainable for us to do so. And that's not a choice that as a healthcare provider I should have to make. I should just be able to do what I went to school, what God put me on this earth to do, which is to care for people. So I think that anything that we look at has to be looked at through the lens of making sure that the practitioners that are here to serve all patients, those underserved patients included, make sure that they're able to do so in a sustainable manner based on not the profitability of 3, Fortune 12 companies, but of what we as practitioners need, the resources, the tools, in order to do what's right by those patients.
Yeah, thank you for those insights. This industry is dominated by 3 big PBMs that control about 80% of the entire market. These PBMs also integrated with insurance companies and pharmacies to funnel business toward their own pharmacies at the expense of our independent community pharmacies, which our communities lean on. Dr. Dwayne, does this create a conflict of interest, in your opinion?
It absolutely does. I think that no matter what walk of life you come from or what kind of insurance you carry, you ought to be able to choose the person that you receive care from. And when the PBMs restrict their networks or when they, steer you through the advertising that they send to your home or the logo that they print on your insurance card, it makes you second guess yourself or wonder, if you can go to a certain practitioner or if you're forced to go to a different pharmacy or something like that. So I think that it does disadvantage people because, this is a very difficult concept for someone like me who lives it and breathes it every day, but for someone who, is of low health literacy or is just not able to involve themselves in their care to the extent that they may want to, it becomes almost insurmountable to understand really the complexities of that system. And I think that the PBMs end up taking advantage of that. And they rely on people to not investigate and instead to just kind of, go with their intention, which is to push them to the pharmacy that they stand to benefit from the most.
And with that, I yield back. Thank you, Dr. Dwayne.
Thank you. Chair recognizes Mr. Fallon from Texas.